Hi and welcome viewers of Nursing Academy 101. In this video, we'll talk about nursing ethics, multiple choice questions and answer, part 1. But before we start, please don't forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question number 1. Values are A. Thoughts a person has. B. Principles one chooses to live by. C. Knowing right from wrong. D. One's integrity. The answer is B. Principles one chooses to live by. Question number 2. If there is one heart available for transplant and healthcare professionals must make the decision as to who gets the heart, which bioethical principle is involved? A. Integrity. B. Beneficence. C. Non-malfeasance. D. Justice. The answer is D. Justice. Question number 3. The reason that most people enter the healthcare field is grounded in the principle of A. Non-malfeasance. B. Integrity. C. Beneficence. D. Justice. The answer is B. Integrity. Question number 4. Actions that show respect for human dignity, such as being honest and putting the patient first, reflect which of the following principles? A. Integrity. B. Justice. B. Beneficence. D. Non-malfeasance. The answer is A. Integrity. Question number 5. Which primary ethical nursing value is being followed by a nurse who respects the wishes of a patient to decline to receive information about her health condition? A. Promoting and respecting informed decision making. B. Preserving dignity. C. Being accountable. D. Promoting health and well-being. The answer is A. Promoting and respecting informed decision making. Question number 6. A nurse manager has a staff nurse who observes certain religious holidays. The manager tries to make sure that these observances can be met with possible. The manager is practicing which of the following values? A. Social justice. B. Autonomy. C. Human dignity. D. Altruism. The answer is D. Altruism. Question number 7. Parents of a terminally ill child have decided to remove their child from life support, a decision that has met with much negative support. The nurse practices the value of autonomy through which of the following? A. Referring the parents to social services. B. Asking to be assigned to a different client. C. Respecting the parents' decision. D. Showing respect for the family. The answer is C. Respecting the parents' decision. Question number 8. A nurse is working with a local agency to provide care to the inadequately insured by helping to staff an after-hour clinic. This nurse is demonstrating which of the following professional values? A. Altruism. B. Social justice. C. Integrity. D. Human dignity. The answer is B. Social justice. Question number 9. A nurse mistakenly gave a client who was MPO a morning breakfast tray. After realizing the mistake, the nurse notified the physician as well as the client, explained the consequences of this mistake. which include a delay in the client's scheduled procedure, and documented the situation to the client's medical record. This nurse demonstrates which of the following: A. Altruism, B. Human dignity, C. Social justice, D. Integrity. The answer is D. Integrity. Question number 10. The definition of ethics is: A. The values that influence human behavior. B. Tying our actions to what is right or wrong. C. One's moral principles. D. All of the above. The answer is D. All of the above. Question number 11. Essentially, ethics stems from: A. Autonomy, B. Morality, C. Self-regard, D. B and C. The answer is B. Morality. Question number 12. The principle of doing no harm is called: A. Integrity, B. Beneficence, C. Non-maleficence, D. Autonomy. The answer is C. Non-maleficence. Question number 13. The nurse who fails to remove a patient from an unsafe situation has violated which bioethical principle? A. Justice, B. Fidelity, C. Veracity, D. Beneficence. The answer is D. Beneficence. Question number 14. The nurse who respects the patient's right to refuse treatment is following which bioethical principle? A. Justice, B. Beneficence, C. Autonomy, D. Fidelity. The answer is C. Autonomy. Question number 15. What is the principle that ethics should be based on what is consistent and fair to everybody? A. Beneficence, B. Non-maleficence, C. Autonomy, D. Justice. The answer is D. Justice. Question number 16. The nurse working in family practice is assessing an elderly female patient and notices bruises on the patient's arm and back. Which action is the most appropriate for the nurse to take? A. Ignore the bruises because her daughter tells you that her mother is clumsy. B. Do nothing because you can't prove anything. C. Report the suspected abuse to the appropriate authorities. D. Confront and accuse the daughter of elder abuse. The answer is C. Report the suspected abuse to the appropriate authorities. Question number 17. When healthcare professionals attempt to improve the situation surrounding the patient, they are practicing which of the following principles? A. Autonomy, B. Beneficence, C. Bioethics, D. Non-maleficence. The answer is B. Beneficence. Question number 18. Which of the following is most closely aligned with the principles and concepts of informed consent? A. Justice, B. Fidelity, C. Self-determination, D. Non-maleficence. The answer is C. Self-determination. Question number 19. A student nurse realized that she has administered the wrong dose of medication to a patient. She immediately informed her clinical instructor. This student nurse is best described professionally as: A. Confident, B. Trustworthy, C. Compliant, D. Accountable. The answer is D. Accountable. Question number 20. The physician has informed a client that she has cancer. The client tells the nurse and physician that she is not sure if she wants her family to know. The nurse encourages the client to consider sharing the information with her family so they can support her through the decisions she will need to make regarding her care. The nurse is using the principle of A. Confidentiality, B. Fidelity, C. Veracity, D. Justice. The answer is C. Veracity. Question number 21. A client in the emergency department believes that she has been waiting longer than the other individuals because she has no insurance. The ethical principle that is involved in this particular situation is A. Justice, B. Autonomy, C. Beneficence, D. Non-maleficence. The answer is A. Justice. Question number 22. A client's family member says to the nurse, "The doctor said he will provide palliative care." What does that mean? The nurse's best response is A. The goal of palliative care is to effect a cure of a serious illness or disease. B. Palliative care is given to those who have less than 6 months to live. C. Palliative care aims to relieve or reduce the symptoms of a disease. D. Palliative care means the client and family take a more passive role and the doctor focuses on the physiological needs of the client. The location of death will most likely occur in the hospital setting. The answer is C. Palliative care aims to relieve or reduce the symptoms of a disease. Question number 23. Veracity is a term that relates to the practice of A. Being thorough, B. Telling the truth, C. Honoring a patient's autonomy, D. None of the above. The answer is B. Telling the truth. Question number 24. Fidelity is a principle pertaining specifically to the concept of A. Faithfulness, B. Charity, C. Benevolence, D. A and B. The answer is A. Faithfulness. Question number 25. Even though the nurse may obtain the client's signature on a form, obtaining informed consent is the responsibility of the A. Client, B. Physician, C. Supervising nurse, D. Student nurse. The answer is B. Physician. Question number 26. The admitting nurse explained the process of signing form to allow for the client's insurance company to be billed for services. If the insurance fails to pay for services, the client is responsible for payment. This is an example of which of the following: A. Tort law, B. Administrative law, C. Statutory law, D. Contract law. The answer is D. Contract law. Question number 27. What kind of contract exists when a nurse is holding the thermometer and says, "Put this under your tongue," and the patient put the thermometer under his or her tongue? A. Implied contract, B. Administrative law, C. Statutory law, D. Written contract. The answer is A. Implied contract. Question number 28. A client is to undergo an invasive procedure by a physician. The client is questioning some of the terminology in the consent form. Which of the following is the best response by the nurse? A. You should have asked your physician when he was in here. B. I will call your physician back in the room to answer your questions. C. Just sign the form and I'll make sure your physician talks to you before he begins the procedure. D. I will explain whatever you don't understand. The answer is B. I'll call your physician back in the room to answer your questions. Question number 29. An elderly adult fell at home and fractured a hip, which requires surgical repair. After admittance to the emergency department, the client was given sedation for pain before a surgical permit was signed. What is the best action necessary to obtain consent? A. The physician should have the client's wife sign the consent form. B. This would be considered an emergency situation and consent would be implied. C. Since the client has been medicated, the nurse should thoroughly explain the consent form to the client. D. The physician should wait until the effects of that medication wear. The answer is A. The physician should have the client's wife sign the consent form. Question number 30. A client is brought to the emergency department after being involved in a motor vehicle crash. Although the client is conscious, her condition is critical and will require emergency surgery. The client doesn't speak English. What is the best action of the staff? A. Explain as best they can using picture and gestures. B. Have the hospital interpreter explain the procedure. C. Read the consent form and have the client sign it anyway. D. Proceed with surgery as consent would be implied in this situation. The answer is B. Have the hospital interpreter explain the procedure. Question number 31. A nurse who is opposed to abortion works in a hospital where they are performed. According to the policy, the nurse A. Can counsel women before they have an abortion. B. Has the right to refuse to participate in abortion. C. Shouldn't be working in this particular hospital. D. Can't interfere with a woman's constitutional right. The answer is B. Has the right to refuse to participate in abortions. Question number 32. An adult client who can treat needs surgery and is competent to make his own decisions. The best action of the nurse is to A. Have a family member who can read sign the consent form. B. Make sure the physician explains the procedure to the client. C. Tell the client in the nurse's own words what the surgical procedure involves. D. Read the consent form to the client and have the client state understanding. The answer is D. Read the consent form to the client and have the client state understanding. Question number 33. Steps the RN can take to reduce the risk of malpractice include all of the following except A. Administer drugs carefully. B. Document accurately. C. Don't delegate any task. D. Think before you speak. The answer is C. Don't delegate any task. Question number 34. A nurse educator is preparing a presentation on professional negligence. The nurse determined that all of the following actions would be considered professional negligence except A. Administering the wrong medication. B. Failure to obtain informed consent. C. Taking a picture of a patient without his or her consent. D. Refusing to permit the patient to walk without assistance. The answer is D. Refusing to permit the patient to walk without assistance. Question number 35. A nurse gives a double dose of acetaminophen, Tylenol, to a client who only requires a single dose. What, if anything, must the nurse do? A. Ask a colleague to help assess the client. B. Withhold the client's next dose of Tylenol. C. Report the error as soon as possible. D. Nothing, because this is an over-the-counter medication. The answer is C. Report the error as soon as possible. Question number 36. Which of the following is not considered a major law that governed our society? A. Criminal law. B. Common law. C. Statutory law. D. Administrative law. The answer is A. Criminal law. Question number 37. A nurse is working the night shift on a respiratory floor. She is walking toward a patient's room when she sees a nursing assistant performing patient care with the curtains and door open. The nurse notes that the nursing assistant is violating which legal principle? A. Right to privacy. B. False imprisonment. C. Failure to rescue. D. Informed consent. The answer is A. Right to privacy. Question number 38. The nurse on a busy surgical floor is preparing her patient for surgery. The patient refuses to sign the surgical consent form because he has not spoken to the surgeon regarding the procedure. When the nurse speaks to the surgeon on the phone, he tells her that he is too busy to come to the floor. If the nurse were to insist that the patient sign the consent anyway, she would be violating which of the patient's right? A. Right to refuse treatment. B. Confidentiality. C. Right to informed consent. D. Right to privacy. The answer is C. Right to informed consent. Question number 39. The nurse has an adequate understanding of a tort when she makes which statement? A. A tort is a legal wrong committed against another person or their property. B. A tort refers to the nurse's duty to practice within the boundaries of the nurse's role. C. A tort is a principle concerned with being fair or just. D. A tort refers to the truth-telling and not intentionally misleading patients. The answer is A. A tort is a legal wrong committed against another person or their property. Question number 40. A confused client who fell out of bed because side rails were not used is an example of which type of liability? A. Battery. B. Negligence. C. Assault. D. Felony. The answer is B. Negligence. Question number 41. The nurse puts a restraint jacket on a patient without the client's permission and without the physician's order. The nurse may be guilty of A. Assault. B. Negligence. C. Battery. D. Invasion of privacy. The answer is C. Battery. Question number 42. The nurse threatens to place a verbally abusive patient in restraint. The patient could press charge against the nurse for which of the following? A. Battery. B. Assault. C. Malpractice. D. Negligence. The answer is B. Assault. Question number 43. An RN administers an ordered dose of medication over the patient's refusal. On review, the manager interprets this action to be A. Assault. B. Battery. C. Negligence. D. Malpractice. The answer is B. Battery. Question number 44. The four elements that must be present for a person to recover damage as the result of alleged malpractice are duty, breach of duty, actual injury, and A. Insurance. B. Battery. C. Intent. D. Causation. The answer is D. Causation. Question number 45. A nurse is working in the surgical recovery unit and is caring for a patient who is still under anesthesia. She knows that the patient's oxygen level is 82% on room air. What would the nurse be guilty of if she forget to apply oxygen for this patient? A. Commission of an act. B. Nothing, because the patient will naturally recover from the anesthesia. C. Professional negligence. D. Assault and battery. The answer is C. Professional negligence. Question number 46. A nurse forgets to put the call light within the client's reach and then leaves the room. The client reaches for it and falls out of bed. The nurse could be charged with which of the following? A. Assault. B. Battery. C. Malpractice. D. Negligence. The answer is D. Negligence. Question number 47. A client woke in the middle of the night, confused and unaware of the surroundings. Although the call light was within reach, the client got out of bed unassisted, tripped on the bedside chair, and fell. Which of the following elements of malpractice is missing in this case? A. Injury. B. Duty. C. Forcibility. D. Damage. The answer is C. Forcibility. Question number 48. The nurse makes this entry in a client's medical record. The client is a drug addict and is always asking for more medication than is necessary. In this situation, the nurse may be charged with which of the following? A. Defamation. B. Incompetence. C. Liable. D. Slander. The answer is C. Liable. Question number 49. If a physician fails to use the degree of skill and learning commonly expected in that individual's profession, the physician could be guilty of A. Assault. B. Battery. C. Malpractice. D. Negligence. The answer is C. Malpractice. Question number 50. Failure to give care that is normally expected of a person in a particular position with resulting injury to another person. A. Assault. B. Battery. C. Malpractice. D. Negligence. The answer is D. Negligence. Question number 51. A person who is under the influence of drugs doesn't have the legal capacity to form a contract because she has A. Legal disability. B. Incompetence. C. Liable. D. Slander. The answer is A. Legal disability. Question number 52. A nurse is helping a patient walk and jerks the patient by the arm, causing a bruise. The nurse may be guilty of A. Assault, B. Battery, C. Malpractice, D. Negligence. The answer is B. Battery. Question number 53. If a healthcare worker makes false statements about a patient that cause the patient to be damaged or ridiculed, the healthcare worker may be guilty of A. Defamation, B. Incompetence, C. Libel, D. Negligence. The answer is A. Defamation. Question number 54. Unnecessary exposure of an individual or revealing personal information about an individual without consent. A. Invasion of privacy, B. Incompetence, C. Liable, D. Negligence. The answer is A. Invasion of privacy. Question number 55. A nurse is caring for an elderly patient with terminal cancer. The patient has just told his family that he wants to end treatment and be kept comfortable for the remainder of his life. His family is very upset and doesn't agree with his decision. Both the patient and his family have confided their wishes to the nurse privately, and the family has asked the nurse to intervene. How would you classify the ethical dilemma that the nurse is experiencing? A. Right to life, B. Informed consent, C. Right to die, D. Medical futility. The answer is C. Right to die. Question number 56. A nurse is working the night shift in the ICU. She noticed cardiac alarm sounding for one of the patients, and on arriving to the patient's room, find him in full cardiac arrest. It's later determined that the patient's assigned nurse was at the front desk sleeping. The nurse realized the importance of reporting this issue but doesn't want to face backlash from her coworker, which describes what the nurse is experiencing. A. Decision making, B. Ethical dilemma, C. Preconceived beliefs, D. Discrimination. The answer is B. Ethical dilemma. Question number 57. Which statement is correct about the bioethical decision-making theory of deontology? A. It's concerned only with consequences. B. It judges actions based on motive or intent. C. It emphasizes treating others as a means to an end. D. It can be applied to research. The answer is B. It judges action based on motive or intent. Question number 58. The student understands the ANA Code of Ethics for Nurses when she identifies which statement as incorrect. The Code of Ethics for Nurses A. provides a framework for ethical decision making. B. is non-negotiable. C. is applicable to most practice settings. D. helps with professional self-regulation. The answer is C. is applicable to most practice settings. Question number 59. The RN student has been studying ethics in healthcare. Based on what she has learned, how would she explain the bioethical principle of autonomy? A. It states that the physician knows what is best for the patient. B. It does not apply to informed consent. C. It refers to patient self-determination. D. It states that every patient has a right to health care. The answer is C. It refers to patient self-determination. Question number 60. For the RN to practice ethical decision making, it is most important for him or her to A. Base decision making on whether an action is right or wrong. B. Base decision making on possible consequences. C. Accurately assess a situation. D. Seek the assistance of an ethics committee. The answer is C. Accurately assess a situation. Question number 61. Who is the most important person in the healthcare organization's code of ethics? A. Healthcare professional. B. Patient. C. Physician. D. Hospital administrator. The answer is B. Patient. Question number 62. Ethical theory based on the greatest good for the greatest number is called A. Integrity. B. Values. C. Utilitarianism. D. Tolerance. The answer is C. Utilitarianism. Question number 63. This ethical theory is based on the obligation of the individual to perform his or her responsibility no matter the circumstance. A. Teleology. B. Deontology. C. Rights-based ethics. D. Justice-based ethics. The answer is A. Teleology. Question number 64. In the 7-step decision-making model, what is the first step that should be taken? A. Determine the exact ethical issue involved. B. Determine the rules, laws, principles, or values are involved. C. Determine all the facts of the situation. D. List all possible courses of action. The answer is C. Determine all the facts of the situation. Question number 65. Zana, 2 months old baby, admitted to doctor clinic to take a hepatitis vaccine. What level of preventive care this baby received? A. Primary prevention. B. Secondary prevention. C. Tertiary prevention. D. Fourth prevention. The answer is A. Primary prevention. Question number 66. Patient Ziad, 50 years old, admitted to emergency department for severe headache. CT scan scheduled to diagnose his severe headache. What level of preventive care Ziad is receiving? A. Primary prevention. B. Secondary prevention. C. Tertiary prevention. D. Fourth prevention. The answer is B. Secondary prevention. Question number 67. Hadi, 35 years old male, started receiving chemotherapy treatment after he diagnosed with lung CA. What level of preventive care Hadi is receiving? A. Primary prevention. B. Secondary prevention. C. Tertiary prevention. D. Fourth prevention. The answer is B. Secondary prevention. Question number 68. Samia, 27 years old female, started with rehabilitation management for her leg broken after car accident. What level of preventive care Samia is receiving? A. Primary prevention. B. Secondary prevention. C. Tertiary prevention. D. Fourth prevention. The answer is C. Tertiary prevention. Question number 69. During carrying an doctor order, a nurse work in the medical surgical unit noticed that there is no signature. She refused to carry this order. What nursing role in this situation was applied? A. Autonomy. B. Accountability. C. Caregiver. D. Advocate. The answer is A. Autonomy. Question number 70. What is the role the nurse provide when bathing a patient in intensive care unit? A. Autonomy. B. Accountability. C. Caregiver. D. Advocate. The answer is C. Caregiver. Question number 71. A student nurse accidentally left the call light outside the reach of an elderly client. Luckily, another nurse found the situation and was able to rectify the matter before something happened. The student responded, I know better. I should have double checked where the light was before I left the room. This student is demonstrating which of the following? A. Responsibility. B. Justice. C. Accountability. D. Fidelity. The answer is C. Accountability. Question number 72. A 20-year-old client with Down syndrome is able to live in an assisted environment and work part-time for a local bookstore. The parent of this client is adamant about not initiating a course of treatment whose side effects are unknown with Down syndrome client. According to the Nursing Code of Ethics, the nurse's first loyalty is to which of the following? A. The parent. B. The physician. C. The client. D. The nurse. The answer is C. The client. Question number 73. A toddler who has just been admitted to the pediatric unit is crying and scared. No treatment has been initiated at this point. The nurse needs to start an IV and the parents ask, will this be painful to my child? In a practicing veracity, the nurse responds, A. We do this all the time, so don't worry. B. It shouldn't be too bad, and I will be quick. C. I won't lie to you. It might be easier for you if you step out until we get the line in. D. We'll take every care not to hurt your child. The answer is C. I won't lie to you. It might be easier for you if you step out until we get the line in. Question number 74. A home health client has been prescribed nutritional supplements 3 times a day. The formula is expensive and the client tells the home health nurse that she is taking them 3 times a day. By diluting them so she can use only 1 can, not 3 per day. As a client advocate, the nurse should A. Tell the client that she needs to take the prescribed amount. B. Weigh the client on a weekly basis to monitor weight gain or loss. C. Help the client look for available community resources that might be of assistance. D. Report the situation to the physician. The answer is C. Help the client look for available community resources that might be of assistance. Question number 75. Nurse Julia noticed during her shift round that wound dressing was wet and oozing blood. What is the priority Julia have to do? A. Change dressing. B. Cover it with more gauze. C. Notify physician. D. Nothing, it's normal. The answer is A. Change dressing. Question number 76. A nurse provides additional information for a client who is trying to decide whether or not to accept a treatment. This student is demonstrating which of the following? A. Autonomy. B. Accountability. C. Caregiver. D. Advocate. The answer is C. Caregiver. Question number 77. A student nurse realized that she has administered the wrong dose of medication to a patient. She immediately informed her clinical instructor. This student nurse is best described professionally as A. Confident. B. Trustworthy. C. Compliant. D. Accountable. The answer is D. Accountable. Question number 78. Which recipient of nursing is perceived as a person who accepts responsibility for their health? A. Individual. B. Patient. C. Consumer. D. Client. The answer is D. Client. Question number 79. An elderly client wants to return home after her hip replacement. The family wants her to go to a nursing home. Acting as a client advocate, the nurse A. Inform the family that the client has a right to decide on her own. B. Ask the physician to discharge the client to home. C. Suggest the client hire a lawyer to protect her rights. D. Help the client and family communicate their views to each other. The answer is D. Help the client and family communicate their views to each other. Question number 80. A staff nurse teaches a new graduate nurse a more efficient method of doing a technical procedure, such as inserting an intravenous catheter. What source of knowledge is applied? A. Authoritative knowledge. B. Scientific knowledge. C. Philosophy. D. Traditional knowledge. The answer is A. Authoritative knowledge. Question number 81. Changing bedclothes every morning by a practical nurse in medical surgical unit is an example for A. Authoritative knowledge. B. Scientific knowledge. C. Philosophy. D. Traditional knowledge. The answer is D. Traditional knowledge. Question number 82. Research is a type of A. Authoritative knowledge. B. Scientific knowledge. C. philosophy, D. Traditional knowledge. The answer is B. Scientific knowledge. Question number 83. An adult client who can't read needs surgery and is competent to make his own decisions. The best action of the nurse is to A. Have a family member who can read sign the consent form. B. Make sure the physician explains the procedure to the client. C. Tell the client in the nurse's own words what the surgical procedure involved. D. Read the consent form to the client and have the client state understanding. The answer is D. Read the consent form to the client and have the client state understanding. Question number 84. Which ethical principle underlies nursing actions respecting each patient's values and beliefs? A. Autonomy. B. Beneficence. C. Justice. D. Responsibility. The answer is A. Autonomy. Question number 85. A nurse is having difficulty with the decision for aggressive cancer therapy in an elderly client, wondering whether the therapy actually will be more harmful than the disease, and knowing that the client will be subjected to harmful chemicals. This nurse is struggling with which of the following principles? A. Beneficence. B. Justice. C. Autonomy. D. Non-maleficence. The answer is A. Beneficence. Question number 86. A complex organized occupation preceded by a long training program is A. Professional. B. Autonomy. C. Expert. D. Nurse. The answer is A. Profession. Question number 87. Space relates to the characteristic of having a high level of specialized skills and knowledge. A. Profession. B. Wisdom. C. Expertise. D. Skill. The answer is C. Expertise. Question number 88. Self-governing is another word or definition for A. Expertise. B. Autonomy. C. Profession. D. Accountability. The answer is B. Autonomy. Question number 89. Space refers to a person who has an obligation to accept responsibility and to account for actions. A. Autonomy. B. Authority. C. Expertise. D. Accountability. The answer is D. Accountability. Question number 90. Autonomy literally means A. Self-governing. B. Do not harm. C. Interdependence. D. None of the above. The answer is A. Self-governing. Question number 91. In nursing, there are many implications with autonomy, such as A. Informed consent. B. Advance directive. C. End of lives issues. D. All of the above. The answer is D. All of the above. Question number 92. A nursing advocate is one who A. makes decisions for others. B. Encourages people to make decisions for themselves and acts with or on their behalf to support those decisions. C. Manages the care of others. D. Is the legal representative for a person. The answer is B. Encourage people to make decisions for themselves and act with or on their behalf to support those decisions. Question number 93. Advocacy is defined as A. Helping another. B. Arguing, supporting, or defending a client cause. C. The principle of doing no harm. D. A duty to do good. The answer is B. Arguing, supporting, or defending a client cause. Question number 94. Being answerable for one's own actions is assuming A. Accountability. B. Responsibility. C. Non-malfeasance. D. Veracity. The answer is A. Accountability. Question number 95. A nurse is caring for a patient with end-stage lung disease. The patient wants to go home on oxygen and be comfortable. The family wants the patient to have a new surgical procedure. The nurse explains the risks and benefits of the surgery to the family and discusses the patient's wishes with the family. The nurse is acting as the patient's A. Educator. B. Advocate. C. Caregiver. D. Case manager. The answer is B. Advocate. Question number 96. In an acute care hospital, the patient might expect which persons to act as advocates for him or her? A. The nurse. B. The social worker. C. The physical therapist. D. All members of the interdisciplinary team caring for the patient. The answer is D. All members of the interdisciplinary team caring for the patient. Question number 97. You and a colleague are on the elevator after your shift, and you hear a group of health caregivers discussing a recent patient scenario. Which patient right might be breached? A. Right to refuse treatment. B. Right to continuity of care. C. Right to confidentiality. D. Right to reasonable responses to requests. The answer is C. Right to confidentiality. Question number 98. The patient's right to refuse to participate in research involves which of the following? A. Research on a new cancer medication. B. Research on a new walker by physical therapy. C. Research into the body's hormonal response to stress. D. All of the above. The answer is D. All of the above. Question number 99. Your patient requires an injection to maintain therapeutic levels of the medication. The client doesn't want the medication, but you give the medication per physician's order. You have violated which patient's right? A. Privacy. B. Considerations and respect. C. Refusal of treatment. D. You have violated no patient's right as the medication was ordered by the physician. The answer is C. Refusal of treatment. Question number 100. Veracity is a term that relates to the practice of A. Being thorough, B. Telling the truth, C. Honoring a patient's autonomy, D. None of the above. The answer is B. Telling the truth. Question number 101. The nurses participate in a nursing lecture about the hazards of tobacco use. Nurse explained the effect of smoking on health. What is the aim of nursing indicated? A. To promote health, B. To prevent illness, C. To restore health, D. To facilitate coping with disability or death. The answer is A. To promote health. Question number 102. A nurse teaches a patient how to avoid urinary tract infection through good hygiene. The nurse's aim is A. To promote health, B. To prevent illness, C. To restore health, D. To facilitate coping with disability or death. The answer is B. To prevent illness. Question number 103. The nurse assesses a patient and performs blood tests to diagnose anemia. The aim indicated is for A. To promote health, B. To prevent illness, C. To restore health, D. To facilitate coping with disability or death. The answer is C. To restore health. Question number 104. The nurse helps a patient with an amputated leg to use the wheelchair for ambulation. The aim indicated is A. To promote health, B. To prevent illness, C. To restore health, D. To facilitate coping with disability or death. The answer is D. To facilitate coping with disability or death. Question 105. The nurse places an intravenous catheter without patient complaint and unwanted side effects. What is the nurse skill considered? A. Cognitively skilled nurses, B. Technically skilled nurses, C. Interpersonally skilled nurses, D. Intrapersonally skilled nurses. The answer is B. Technically skilled nurses. Question 106. The nurse is very knowledgeable. She uses her skills to provide patient education to the patient before discharge. Indicate which skill is used. A. Technical skills, B. Compassion skills, C. Interpersonal skills, D. Cognitive skills, E. Legal skills. The answer is D. Cognitive skills. Question 107. The nurse coordinates and plans a workshop about palliative care for other members of the healthcare team. The nurse role is A. Caregiver, B. Advocate, C. Accountability and autonomy, D. Manager. The answer is D. Manager. Question 108. A leader is someone that provides the vision, skills, and tools needed by nurses currently in or aspiring to leadership positions. B. Process of helping a client to recognize and cope with stressful psychological or social problem. C. Explains to clients concepts and facts about health. D. Helps client regain health through the healing process. The answer is A. is someone that provides the vision, skills, and tools needed by nurses currently in or aspiring to leadership position. Question 100 now. Only one answer best describes a profession. Choose the correct answer. A is an activity undertaken by the person to earn his livelihood. B. It can be business, profession, or employment that a person undertakes to make money. C. Occupation and profession are synonyms. D. Is an activity that requires specialized training, knowledge, qualifications, and skills. The answer is D. Is an activity that requires specialized training, knowledge, qualifications, and skills. Question 110. A novice nurse is a nursing student, any nurse entering a clinical setting where the person has no experience. B. Can demonstrate marginally accepted performance. C. The nurse who has been on the job in similar situation for 2 to 3 years manifests competence. D. The nurse focuses on long-term goals and is oriented toward managing the nursing care. The answer is A. A nursing student, any nurse entering a clinical setting where the person has no experience.